in Instagram live, I try to take one remedy or take one rubric or take one case and try to make you understand what I've understood in my practice. In YouTube live, we basically deal with the questions of the doctors and try to answer that question. Now, there was a very interesting case I would like to discuss first in this YouTube, and let us understand the meaning of what is that. There was a case of a person who was about 20 years of age, a child, studying away from home, and a very lovely child, a very stoic child, happy, good in studies, everything. But once he went to studies, he started, getting stomach upsets, recurrent, pain in the throat, and getting sick. So much so that he felt that his immunity had gone down, could not concentrate in studies, and all XYZ. So this symptom, and he had been taking antibiotics. He had been taking homeopathy medicines also, but there was no change in his health. Means there was no cure. So in this case, then he took some allopathy, homeopathy, and then the patient came to me. Whatever I could get from the case, understand how did I enter that case. I found that the patient, had that never-ending deep longing. You can say yearning, 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 hoping that something is not available to him. That is outside home, parents, father, mother, sister, uncle, auntie. So he was, no, he was eating good food, but still he was losing weight, and there was a bit of emaciation in that boy. You could say a nutritional deficiency, severe malabsorption, and he started becoming thin. He started becoming thin, and he started becoming underweight. So I found that he was missing something. He was missing someone in the whole case, and that's why he was suffering from recurrent cough and cold, throat pain, ear pain, recurrent diarrhea, could not digest food, could not concentrate on studies, mentally very irritable, very morose. This was the whole case. So what remedy comes to your mind? I gave that remedy one dose, and the next day his mother called me and said that for the first time after so many months he has asked for food, and he ate so much food. He ate chicken, he ate fish and everything. Next day he got again diarrhea, but I said don't give him anything and just wait, and he was much better. So this was the case. Now what do you make of the case? How to enter that case? And what rubric to take for prescription? That is very important. So try to analyze the case so that we can get to the remedy. This was the gist of the case, whatever I could get in the case taking. So welcome Dr. Singh, welcome Dr. Babal, Real Matter, Dr. Kulkarni. So this was the case. So what remedy comes to your mind and what symptoms that you have to take for prescription, that is also very important. So anybody can understand what I want to tell you and what remedies to think at that time. Anyone? Did you understand the case? Understanding of the case is very important. Okay, so this is very nice. I also thought the same thing, that losing flesh while eating well, very important. Anything else that comes to your mind? Yes, but could you understand, could you appreciate that mental nature which I took for prescription? That is very important. I just gave you the gist of the case, how I approached that case, and to hear from his mother, the next day, that for the first time he had asked for food after so many months, after 3 months, and he ate food. He ate so much food that his stomach got upset. He got the same symptoms of diarrhea, but with nothing, with one placebo, and the patient was better. Brownie and Dulcamara in weather change condition. I'll get back to you. I'll get the first. Let me discuss what I wanted to tell in this case. So, okay. So you all study the case and try to analyze the case, and then we'll get what remedy I give. Remedy is not so important. How do you approach this case? You can always definitely take the symptom, living, eating well, but still having a problem. So now you say, for example, bryonia and dulcamara. Now, whatever symptoms you know, first of all, of the remedy, it is important that you basically understand from that context only. It is not always you remember the rare symptom of a remedy, then you can enter the remedy. Whatever remedy you have, you can enter from that. For example, dulcamara and bryonia, respiration is difficult in both the cases whether weather is cold and in damp wet weather. Both the remedies have the same symptom. More in dulcamara, less in bryonia. Okay. Now, in bryonia and dulcamara, the patient catches cold after cough. The patient catches cold after cough, that is bryonia. And in dulcamara, there is asthmatic respiration in wet weather. Are you with me? Just try to understand what I want to tell you. In bryonia, the respiration is difficult when overheated, which is not there in dulcamara. In bryonia, the patient is not able to expand his lung. That is bryonia. And in bryonia, external pressure emanates the complaints. In dulcamara, very, very important symptom, the respiration is difficult and urination aggravates the complaints. This is a very, very important symptom in dulcamara. One of the very important symptoms in dulcamara is snoring. A dulcamara patient has snoring while lying on the back. This is very, very important. And one more symptom of dulcamara is the cough is barking whenever the patient takes very deep breath. That is dulcamara. Okay. And remember one thing, that in dulcamara, cough is from suppressed eruption. Now, whenever there is cough from suppressed eruption, we always think about sulfur. But think about dulcamara, think about croton tig, think about pulsatilla, and think about sorinum also. Are you with me? Are you with me? Are you understanding, Dr. Saab? Dulcamara and this. So both have the same cause, and then try to differentiate what the patient is suffering from. This is very important, what the patient has come to you with symptom. For example, a dulcamara patient will always say that the expectoration is tasteless. But a bryonia patient will say the expectoration tastes as if burnt, or you can say as if smoky. This is the difference of bryonia and dulcamara, though the cause is same. Hello, Dr. Mayur, Dr. Saurabh, and real matter. Yeah. So I was telling you something about the remedy which I gave to that child. That is very, very important to understand, my dear friend, because see, you can take a lot of symptoms to prescribe, but when we get the symptoms and when we get the remedy, then automatically everything matches. But it is very important to understand, it is very important to understand that what symptom to take for prescription. Are you with me? So whenever there is a symptom where the patient tells you that he is missing something, as if he is missing something, his parents or his environment or his home or his friends, so much so that it is deep inside and hoping, but that is not available. So this was the breathlessness, anxiety. Dr. Nitin has all the problem of anxiety. I always tell you, please understand why anxiety. That is very, very important. If you understand why, automatically everything falls. So I took Dr. Barbal, if you could get the rubric right and the remedy right for that case, I prescribed that patient lycopodium. So why lycopodium? Anyone? Why lycopodium? Yes, anyone? Why lycopodium? Now it is important to understand why did I prescribe lycopodium. Apart from all the symptoms, I took only one thing, emaciation. This was nutritional deficiency. Emaciation. This word you have to understand in your Mater Medica, in your head. This is called as pining. 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 There's one symptom written in Lycopodium, that is cough in pining boys. If you open the repertory and say emaciation, pining boys in general, there are 3-4 remedies. One is Lycopodium, one is tuberculinum, one is I think aurum metallicum, and I think one is acid phos also. That is pining. Despondency, indolence, these are all symptoms are there, but there are so many remedies in that it will be very difficult for you to, get the crux of the case. So did you understand pining and Lycopodium, my dear friends? Did you understand? That is very, very important. Pining. Otherwise, what will happen that, sometimes we get the remedy is, close to that, but not the same remedy. That is very, very important. Are you with me? Are you with me? Yes. Pining. So I think rubric Lycopodium. So you have to understand there are 3-4 remedies for that. Sir, weather change, skin complaint, which medicine is thing commonly? Okay. See, first of all, if you do not get the remedy, because of maybe weather change, and it is difficult sometimes to understand that because of the weather change the skin problem is there. So you first have to think what symptom the patient is suffering from. Okay? Are you with me? If you say weather change, then you can write some remedies. You can think of salasaperidol, you can say epismel, you can say kali bichrome, you can say sulfur, you can say nitric acid. But my suggestion to you would be what, to see first what are the symptoms the patient is suffering from, and then if you prescribe, then that will be very important. Okay? Like for instance, itching the skin, exfoliation of skin, dryness of skin, perspiration on skin, whatever symptom, that is also very important. Okay? So I hope you understood that, everyone. Yes, Dr. Babu, pining. Okay. So I applied that rubric pining in the whole constitution and then the remedies, right? See, most of the time the polycrest remedy, the remedy which Hahnemann has written in his chronic disease or Mater Medica Pura, is sufficient, more than sufficient to practice. So first you have to understand the rubric, which normally we understand, but it is very difficult to apply. If you learn applying that rubric, then it will be very, very easy for you to understand. So let us go forward, sir. Sir, one question: if a patient lost her taste of food due to after prolonged cold and cough, what remedy would you prescribe? See, make sure, now see, if the patient has lost the taste after cough and cold, so 2 or 3 things you have to understand. Either the patient had too much symptoms in cough and cold, he took a lot of medicines and he could not get the relief, that's why because of the medicine there's a problem. Or you can take after acute disease there is a problem, or genuine because of the long running of the symptoms of cough and cold there's a problem. You can think a lot of remedies. We have remedies like influenza, soranum, antimcrude, sulfur, allium cepa, lot of remedies. But I would like you to basically see the symptoms rather than go into that symptom. Lot of people used to ask me first that, sir, loss of taste after COVID, then magnesium is important. But I took the symptoms of the patient at that time of COVID, and after that what was the change, and that gave me good results rather than just prescribing on the taste and magnesium. Are you with me? Please write yes or no so that I can move forward. Sir, asking for psoriasis and all. Now see, in case of psoriasis and eczema, every individual basically is born with some thermals. Some patients are aggravation in winter season, like arsenic, like hipersulf, like soranum, like kalinitricum, like all these remedies. Some patients are aggravated in summers, like sulfur, like lycopodium, like these remedies. So I would tell you not to prescribe only on the change of weather, because chilly patient would be aggravated in winters and hot patient would be aggravated in summers. So if it is so easy, the symptom the patient is suffering from, that is very important. Or otherwise, you have given the constituted remedy, and that is basically, if you feel it will aggravate, then give an intercurrent for chill. For chill, you can give arsenic. In summers, you can give sulfur, or in winters, you can give soranum intercurrent, so that change the patient is not affected for. Okay. Sir, how should a beginner physician manage a patient with goiter, especially after pregnancy? Saurabh, first of all, for me also treating goiter is difficult. I have had lot of cases where I have got good results, but I have lot of cases also where I did not have good results. So it depends on case to case. The easiest approach, whether you are a beginner, so, or whether you are a chronic practitioner, Hahnemann साहब क्या बोलते? What does Hahnemann say? Hahnemann's case taking, Hahnemann's repetization, Hahnemann's miasmatic, and the basics of homeopathy, you can go with that. Okay, so if you go with this, automatically everything is in its place. So make sure that if you are confused, if you don't know where to go, think about this complaints. That is homeopathy, what Hahnemann sir has prescribed. Sir, can we take suppression of skin reactions in skin condition of chronic? Yeah, you can take, definitely. That is given in organ of medicine. No, patient had used warm water bath, leeching, calomel, silver nitrate, or ointments, and suppressed, and then skin complaints. So this you can think of. This is absolutely okay. Okay, I hope you understand that. Will allosocratina help? Everything would help. Everything would help if the remedy is right. Okay, if the questions have been not answered and scrolled up, so you can always ask me, because I would have not seen that question. So now somebody was asking me, I will just give you some more remedies, because sometimes you are confused what to do. In winter, if the complaints are aggravated in winter, then you must think about petroleum, Naxomica, Rustox, Soranum, Pulsatilla, Bryony also sometimes. You can think about winter season aggravation. So there are a lot of remedies. Otherwise, season, that's why I don't ask, because there are so many remedies and so many things you have to take care of. So if that is the problem, then you can. Is it okay, everyone? Constantly screaming, clinging to mother, late to learn, talk, doesn't leave feeding. Okay, so now if the patient is suffering from this problem, clinging, wants mother, first of all, you can take a simple rubric if you want to take, and that is what? Clinging. If you go to clinging, means the remedies like clinging, like camphor or pulsatilla or bismuth or gelsemium, lycopodium also, and phosphorus also. That is clinging. Now sometimes, I had a case where the patient had so much, with the mother, that even the mother used to go to the bathroom, the patient used to sit in the outside the bathroom. That is, you have to first make sure what insecurity the patient is suffering from. That's why there is so much clinging. I have seen in a lot of cases, insecurity is very, very important. Find out that insecurity, and then you can solve the case very easily. Medicines for loose stools for elderly, I have already told you. Think about arsenic, think about leptendra, think about calcareca, think about phosphorus, think about natrum carb also. Okay, so let us go forward. Too much clinging also, the child basically feels left out. Maybe because of he's not happy in the school, he's not happy because the mother and father are fighting, because there's a joint family, or because he feels inferior, or because the mother and father are working, so he's in a crush, or father is outside, he's alone with the mother, father is doing job outside India. These are all the things you have to take care and take into consideration when you are taking this symptom. Is it okay? Yeah, okay. So let us go forward. So did you understand that? Now the same thing, summer aggravation. Now see, this is a very, very close remedies which are good for summer also and for winter. For example, if you say fluoric acid, you can use in both the companies. Now summer aggravates. In summer aggravates, 2 or 3 remedies which I have used very sparingly but with good results. Podophyllum, very, very important. Glonine, Gelsemium, Antimcrude and Belladonna. Chad also screaming loudly whole day, happy family, no conflict, father, mother. Surprising. So now then, if this is the case, then you have to go in the pregnancy history. Why the constitution or why the child is behaving in such a way. That is very, very important. Okay. So that also you have to take into consideration. Maybe in the pregnancy there has been something which has led to that, and the wife had the same feeling what the patient is suffering from. And I would like to add one thing, that sometimes the child is overloved, over pampered, then it becomes a spoiled child. Then you can go to that rubric also, spoiled child, and get the remedy. Okay, is it okay? Yes. So we completed that summer and winter. I hope you understand summer and winter. There are differences which are very hairline. For example, in some cases the eruptions are aggravated in summer. So Letampal, Sarsaparilla, Bovista, Calibacrum gives fantastic results. Okay, crying. Yeah, crying means what? Crying means there is something lacking, wanting. Cry is want. You cry because you have not got love. You cry because you want some food. You cry because you want attention. So it's wanting something. So this wanting part is very, very important. Are you with me? Wanting part, that is a cry. When you want something you don't get and the cry starts. So that also you can think, and then you can prescribe the remedy. So let us go forward. Now I was just telling something about Lycopodium. I hope pining is taken care of. Normally, if you see the recent, the old repertories or Mater Medica, there was only one remedy, that is Lycopodium. But if you see the new repertories, they've added few remedies which I've told, like Aurum metallicum and tuberculinum, natriumur and phosphoric acid and all. So, but to understand that word pining is very, very important. Okay. So let us go forward. And again, if I would like to tell you something more, if there are no questions, like clinging, sometimes we find only that the patient is clinging only because or only during cough time. And sometimes it becomes, the mother says, my child was never like this. But by the time he had cough, that's why he's clinging too much. Whenever the father comes at home, he climbs on the father and whole day is climbing on me. He's clinging so much because of the cough. Then it is very important to see Antim tart, because rattling cough has a lot of remedies. So Antim tart only is famous for rattling, it is there, but clinging during cough, the remedy is Antim tart. Whenever I have given, I have never failed with this rubric. Okay, I was just giving the extension of what I have seen in my practice. Is feeling sleepy after meal seen in Lycopodium patient if the picture matches? See, if you tell me sleepiness after meal, now see, there may be a lot of remedies. But I have never prescribed only on this symptom because the patient is sleepy after meal. If you open the books of Mater Medica, or if you open the repertory also, there may be so many remedies, 20, 30, 40 sometimes remedies for sleepiness after meal. Sometimes it is said that if you eat too much carbohydrate also, you feel sleepy. So in my practice, I would not enter the case or prescribe the remedy only because the patient is sleepy after meals. Now, sleepy after meals, agaricus, Naxomica, sulfur, Staphysagrea, Natrum car, Blackopodium, China, Carbovage, maximum remedies are there. Sir, when can we take desires rubric if the patient eats non-veg 4 times a month? Can we take meat desires? You know, the patient has longing for something so much that he cannot live without it. Craving means what? He wants that thing in spite of anything. He will do robbery also, anything, but he wants that thing. Then please take the rubric of eating, because if it is community based, for example, if you ask Muslim and eating meat 2 times, 3 times, 4 times a day also, sometimes it is common. But if in his family nobody is eating, but this child has a problem of craving, then you can take the rubric to add to your basic rubric. Don't enter the case by what the patient likes to eat. I don't do that, because sometimes it's a psychosis. Sometimes you may be wrong. But if it adds to your repertory chart, then it is well and good. Good medicine for extreme muscle stiffness. All medicines are good. Your similarity has to be there. Sleepless nights but sleeps early morning and wakes 10 a.m. Please suggest medicine patient feeling low mentally. See, if the patient has sleepless nights, so he will definitely sleep in the morning. First of all, you have to ask why there is a difference in the circadian cycle of the patient. Now the answer lies in your question only. You have written low mentally. Just ask the patient. Normally when the patient is in depression or is feeling low, normally they are very happy after sunset, because they don't have to go out, no competition, nothing, so they are very happy in the night. As the morning starts, they don't want to come out from the house, from the room, because the morning starts, the work starts, and they're in depression. So if the patient is low mentally, please ask why. That is the answer to your question. Okay. Are you with me? So did you understand something about sleepiness, eating after? I would not tell you. See, there is also a rubric called sleepiness, dullness after eating. And then it becomes very, very difficult to understand whether you take sleepiness or dullness. So these are different shades where you can add to your repertory chart, but don't enter from this case. Okay, that's what I can tell you. Sir, after COVID she was okay, but this winter she easily catches cold and sneezing, but this time cough too much, having loud barking cough. I gave her Hahnemann 30 tries, but taste lost. Simple as that, my dear friend. If you feel that it is linked to COVID, give the patient COVID 30 single dose, or you can also give influenza, you can give sorinum, you can give antimcrude, depending on the symptom similarity. If COVID is available at your place nearby you, give the patient COVID 30. I think that would help in that case. Medicines for extreme, see, barking cough and too much loud cough, there are few remedies also that you must think about. But the cough is, of course, Hahnemann is definitely the most important. But barking cough, if you open the repertory and if you see, there are remedies like Hahnemann is there, belladonna is there, Hippar is there, Stramonium, Drosera. These remedies also there. If you can compare, then it's okay. Medicines of extreme, see, whenever there is stiffness in the muscles. So what can I tell you now? No, I have never prescribed on this type of symptom, stiffness of the muscles and all. What remedy to tell you? I don't know what to tell, but then if you just feel that the muscles are stiff, you can think about some remedies like, arsenic, bryonia, causticum, rustox, ledum pulse, sepia, silicia. Okay? Are you with me? Are you with me? Yeah. So if you understand, I'm very happy that you understand, so that I know that everybody's understood that, and keep on telling me that you understood, so that I can go a bit further. Okay, that is important for me. fungal infection of nail. Yeah, सबसे पहले the most important thing is fungal infection. Definitely, again, very difficult to treat, and the remedies are very, very simple. You can think about basilinum, think about rustox, think about silicia, think about ichnisia, think about, as I trained, indica. These are the remedies you must think about. Yeah, Devangi, I hope that is okay. But again, whenever there's a fungus or a virus, it is because of the weak immunity, and that's why constitution is important also. In this case, tell the patient at least to not have the detergents and in contact with that, so that that is not taken care of. So it's already half an hour up. Thank you for joining me, and I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you so much.